Hey folks, Dr. Joe Esposito here. So glad you're with us today. What we are doing today, we were joking here. I'm going to do a reading from the book of Joe. Chapter from my book, actually, Prescription for Extreme Health. And I said that, and I did, to Joe-dolls here. And the one, what's your background? You're Lutheran or?
Presbyterian.
So she got that, and as Catholic, that's what I didn't know if other churches use that, but the reading according to the book of Joe here. We're going to talk about exercise today, but we're not going to talk about how to exercise, and you can watch 1,000 million videos on YouTube as to how to exercise. We're going to talk about what happens to the body when you stay in motion. Now, there's a difference. I mean, people think about exercise. Well, I got to hit the gym. I've got to lift weights. Well, just staying in motion is what the body needs. Yes, it's good to lift weights. It's good to do certain exercise, aerobics and things like this. But being in motion is such a key. Now, as a chiropractor, my job is to keep the bones moving. And in chiropractic, it's all about motion. And we can check a joint, any joint, the shoulder, the spine, the foot. And if it's fixated, if it's not moving properly, our job is to go and adjust it and restore normal movement. Because movement is life. And movement allows function, which allows life. And when you lose that function, that's when you start having problems. Now, with the spine, if a bone moves out of place, it can cause inflammation. That can pinch a nerve. Joints can wear out. And any bone in the body, if the joints are out of alignment, they wear out. But we're going to talk way deeper into that. We're talk about how the brain needs motion, how the lymphatic system needs motion, and how it's so important to keep the body in motion. And so whatever exercises you're doing, I'm going to tell you why you're doing and why they work so well and how to make them better. So whether your exercise is getting up and walking around the table, or if you're running marathons, you can actually make it better. Now, if you have any healthcare questions, anything at all, if you're a regular listener, I'm going to open the lines right away. Right, new listeners too. 844-44-Dr. Joe, 844-44-DRJOE. The lines are open right now. We got John as our guest screener today. Wave to John. John's waving back there. And if you have any questions, John's going to take your call and maybe get you on the air. So exercise is really the key to longer life, but not just the classic exercise like we were talking about. This results from a new study. They demonstrate the importance of exercise and movement on your health. And this is so key because people can work out and still have health issues. And I'm going to talk about this later. You can't outrun your fork. When it comes to your health, 85% of your health is going to come from your diet. About my opinion, 15% is going to come from exercise. But exercise and movement is the key to make sure the diet's working. They work off each other. So exercise may be one of the best preventive strategies you have against common ailments, including heart disease and diabetes. The more time you spend sitting, the shorter your life expectancy. That's a big statement right there. Most people spend a good portion of their day sitting. So we got to get you back up and moving around. And this is the negative impact that has from sitting on your cardiovascular system and your metabolic functions. Your metabolism it needs motion to work at its most effective. Now, the World Health Organization lists inactivity as the cause of 3.2 million deaths a year. Now, these people would have died eventually, but the cause of death, now it's not going to be on the death certificate, inactivity, but inactivity led to other issues. So in one meta-analysis, now if you don't know what a meta-analysis is, it's META, meta-analysis. And a meta-analysis, when they take a look at all these different studies and they put it together and then they form their own conclusion. Well, based on 100 studies, this is the answer to the question. So in this meta-analysis, researchers found that those who sat the longest were twice as likely to have diabetes and heart disease compared to those who sat the least. Now, if you're sitting a lot, chances are you're not eating well, and chances are you have other lifestyle issues that need to be addressed. But sitting is the thing that they checked on here. This combination is a high cost on society. We have to take care of you. Those of us who are healthy have to take care of those who are sick. Now, I'm all in support of taking care of people that can't take care of themselves. But if you can take care of yourself, I don't really want to take care of you. And this contributes to billions of dollars each year in healthcare costs and lost productivity. So many people are sick and they just don't work as hard. They don't do all they should. They don't pay attention to their family, their relationships, their families, their churches, their kids. And so all of this starts to pile up. And that can equate to billions of dollars. So you can do your part for the economy and for yourself by just staying in motion. According to these researchers, lack of activity caused more than 5 million deaths a year. To put this in perspective, smoking kills 7 million people a year. Now, there's big movement. You got to stop smoking. You got to quit smoking. We got this vaping crisis. We got this opioid crisis. I think we have a movement crisis. If the body's in motion, the body's going to stay healthier. And a lot of my pain patients, we have to get them moving. And not just moving the body, but moving the joints, moving the spine. That's why chiropractic is so amazingly effective when it comes to pain. The most effective, least expensive treatment for pain, by far, back pain, is chiropractic care. Most effective, least expensive treatment. This should be your first portal of entry when it comes to healthcare if you have pain. Absolutely, positively. And if chiropractic isn't the end-all, be-all, sometimes it's not, then we can add other things to it. But we can save so much money and so much time and so much productivity and so much quality of life by getting you guys out of pain. That's why patients come from all over the world to come see us. We had a patient the other day from Nigeria. We had him from Romania just the other day, too. So patients come from all over the world because they want to get well. And right here in the States, you have us. You can come see us anytime you want. So a couple of things we want to do. I'm going to talk about this chapter I have in my book, Prescription for Extreme Health. It's called Secrets to Extreme Exercise. Now, again, whatever exercise you do, it's okay. I'm going to make it better. When we come back, I'm going to talk about how to make your exercise better and why it makes your brain, your heart, your spine, everything work better.
Lettuce News and Talk.
Hey, Dr. Joe here. So glad you're with us today. We're talking about the benefits of exercise and how to make whatever exercise you're doing. If it's brushing your teeth is the most exercise you have in a day, how to make it better. Because that's the key, is not everybody likes hitting the gym. I don't like going to the gym. I get bored. I'm a little bit of a germaphobe, so I don't like touching everything. Everybody's sweating and wiping and scratching and stroking, and I don't want to touch all that stuff. What are you looking at, Ahmad? What?
I'm just trying to figure out what gym you go to.
Oh, maybe I'll go to the wrong gym then.
Possibly.
No, you go to the gym and the guy's like scratching his armpit, and then he touches the weights, and it's like, I don't want to touch all that. Or they're grunting, and they're spitting all over the place,
They're supposed to have wipes for that, People are supposed to wipe down their equipment after they use it.
They're supposed to is the key word there, Miss Sierra.
Exactly.
Yeah,
that's why I make sure I do it before
you wipe,
I get on the machine and after, because you never know if the person before you did it or not.
Exactly. I remember I had a trainer one time. He always smelled like rotten tuna fish. His breath was so bad. I can't remember his name. He'd be like, lift. I'm like, oh, my God. What died in your colon? My God. You need to get that checked there, cowboy. Anyway, I digress a little bit. So we're talking about exercise, and this is from my book, Secrets for Extreme Health, Prescription for Extreme Health. This is the chapter, Secrets for Extreme Exercise. So why should you exercise? That's the whole key. Why should your body stay in motion? Your heart pumps blood through your body. You know that, and that helps keep the body healthy because it gets blood through the body. How do we do that if we want the blood circulating properly? Diet, exercise, yeah, of course. But we also have two other circulatory systems that nobody ever talks about. And in fact, one of them, the sacro-occipital pump, I've never heard anyone talk about except the researchers that I've dealt with because I helped do some of this research. And the sacro-occipital pump is so important. How many of you know what the sacro-occipital pump is? I'm going to guess none of you raised your hand. Ahmad, you don't even know this one, right? I got you stumped?
Yeah, you got me on that one.
All right, good, okay. I try to stump Ahmad at least once a show. Ahmad's been with me. How many years we've been doing this now? He's my engineer for long.
At least 4?
Yeah.
I don't even know.
I know.
Long time.
I used to have hair back then, So that's how long it's been. But Ahmad's been here. Yes, yes, Sierra. So
I know from typing up the notes.
that's right. Sierra, because we also do a TV show. We do a TV show for Channel 2 in Atlanta. And Sierra is my teleprompter operator, and she puts the teleprompter together. So she knows this stuff. So one person knows. Sierra's smarter than you, Ahmad. There you go.
That's a cheat.
That's it. That's not a cheat. She knows. And why is that a cheat?
Because she learned earlier.
Okay.
From you.
you should know. How many shows have you done now?
Okay, this is
several
true.
hundred, right?
I can't keep all that in my head.
That's true. Yeah.
It pumps brain fluid?
Yeah, it pumps. Yes.
Or spinal fluid.
And Garrett just looked it up, and it pumps cerebrospinal fluid. There you go. I'll give Garrett a bell for that, even though he looked it up. I'll give it to him anyway. So, but we got the sacro-occipital pump and the lymphatics. Now, what lymphatics do? The lymphatic system. There's a little kid running past the studio. What is a kid doing here? This kid's probably about 5 years old. Anyway, I digress again. Lymphatic system filters out viruses, germs, bacteria, pathogens. So what happens is your immune system spots something it doesn't like. Let's assume you eat something you're not supposed to, like, I don't know, gluten or casein from dairy. The immune system has these special cells, and it spots it and it grabs it. And it takes it and it carries it to something called the lymph glands. Now, your lymph glands are in your neck, in your groin, in your chest. If you ever had a sore throat and your glands are swollen, that's the lymphatic system. The lymph glands are swollen because it's filtering out a lot of junk, a lot of what we call pathogens. So the immune system carries the pathogen to the lymph gland, and the lymph gland is kind of like a meeting place. And the body looks at it and says, okay, what is this stuff? What do we do with it? And then the body might say, okay, this is a bad one. We got to get it out of the system. And so now we train the lymphatic system that this is bad, this is bad, this is bad. And eventually it says, okay, now I'm really good at fighting this off. And that's called building up immunity. So the lymph glands filter out all this junk, and then eventually it's broken down by, these white blood cells come in, break it down, then it's flushed out of your system. But the lymphatics don't have a heart like your circulatory system does. So what's going to move the lymphatics? Moving your body, exercise, is what helps the lymphatic system pump and flush out the toxins it breaks down so the immune system can fight off the bad guys. So, and you thought exercise was just for weight loss and bodybuilding. No. Keeping in motion is the key. Now, when I do my shows, whether it's radio, television, if I'm doing recording, I'm always standing because I have to stand. And as I'm standing, my muscles are contracting. And that's actually helping my brain work better because the brain needs input, but it's also helping the lymphatic system. So just staying in motion is the key. Now, if you can't stay in motion, let's assume that there's a situation where you can't move around. Maybe you're wheelchair bound. A massage, you can do what's called a lymphatic massage, and that can get in there and help flush out that as well. So it's a mechanical pump system to move things around. Now, there's also the sacro-occipital pump, and if you're old enough, there was a song by Jefferson Airplane by Grace Slick called White Rabbit, and the line in the song was "Feed your head." Well, this is what the sacro-occipital pump does. It actually feeds your head. So when you're moving, the muscles are contracting the lymphatic system, but you have something called the sacrum, which is your tailbone, and your occiput, which is the back of your brain, and back of your skull. Every time you breathe, the sacrum and the occiput drop down, and as you exhale, they lift up. And so you're pumping fluid up through your spinal cord. And this is pumping the cerebrospinal fluid. Now, the reason this is so important is it brings nutrients up into the brain and the spinal cord. And when you're walking and you're breathing, you're pumping the cerebrospinal fluid. So if you are exercising, you're going to be moving more and breathing more, you're going to be pumping the cerebrospinal fluid better. And that means you're pumping more fluid up into the brain, and you're less likely to be depriving your brain and your spinal cord of nutrients. Now, we have tables, adjusting tables, in all our offices. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. And every one of our tables are what's called a flexion distraction table. And what that means is when you're laying down on your belly, it's really hard to explain this, the bottom part from your waist down drops down a little bit, and it's on a motor, and it pumps up and down. So one of the benefits of using these tables, it pulls apart the vertebrae and takes the pressure off the nerves, and as, of course, chiropractor, that's our job. But another benefit, it's mechanically pumping the cerebrospinal fluid. So it's facilitating the sacro-occipital pump. Now, if you fall on your butt, if you have a low back injury, how many people have low back pain? Raise your hands. A lot of you do. Your sacrum could be out of place. If the sacrum moves out of place, it can actually put pressure on that sacro-occipital pump, and you may have back pain or leg pain or hip pain or butt pain. But more importantly, you're not pumping cerebrospinal fluid. So with chiropractic care, not only does it help relieve the back pain, and does it also open up the nerve supply to the organs, like in low back, it's the colon, sex organs, and bladder that are controlled by those nerves, but it's also pumping the cerebrospinal fluid or realigning the sacrum to allow that pumping of cerebrospinal fluid. So this is another reason why chiropractic care is so vital to good health. We talk about supplements, how important they are. We talk about chiropractic care, how important they are. The super greens and the essential source, minimum supplements you should be taking every day. And every time we do a show, there's another benefit to it. So here's another benefit to making sure your spine is lined up properly. Folks, I'm Dr. Joe Esposito. I have to go to a break. So glad you're there. We're talking today about what exercise does to your body, but not just exercise, movement. Getting the body in motion is so important. Now, if you want to build big muscles, you have to do weightlifting or, you have to do something along those lines. But if you want to stay healthy, this is what we're talking about is movement. Now, I talked about the sacro-occipital pump, which is so important, and I wish more doctors knew about this and more doctors realized that if you have the occiput or the sacrum, any bones in the spine out of place, it can prevent the proper flow of cerebrospinal fluid. Cerebrospinal fluid feeds the brain and the spinal cord, and it's so key. So if you have low back pain, your sacrum can be out of place. If you have headaches, your occiput can be out of place. If you've ever banged your head, I know I played football and hockey and street fights, and God knows what I did to my brain. So that can prevent cerebrospinal fluid flow, and that's so important to normal health. There's taking that to a whole nother level, and this is what got me a little excited, but then I thought I was confused as well, is there's something called equestrian therapy. Now, what equestrian therapy is, it's very effective for children who have certain learning and physical disabilities. Works for adults, too. They usually do it with children, though. The children are put on a horse, and they're led around, just led around a horse stable. And the children are basically riding, but what they're doing is they're rocking back and forth. And if you've ever been on a horse and the horse is walking, you're rocking back and forth. That's facilitating the cerebrospinal pump. And that's pumping cerebrospinal fluid up into your brain. So research shows that equestrian therapy is actually helping the children's brains function more efficiently. One reason, and they don't give the reason. All the research I've ever read, it says, yeah, it works. They don't talk about why. They're pumping the cerebrospinal fluid. They're mechanically manipulating the sacro-occipital pump so that more cerebrospinal fluid is going up into the brain and the spinal cord. So horseback riding is great because you use all your muscles in your body, and it can pump the cerebrospinal fluid. The problem with horseback riding is we get a lot of horseback riding injuries in our chiropractic and pain clinics because people get hurt horseback riding. They fall off or whatever. So you just got to be careful with that. There's another exercise that you can do, and you don't need any equipment. We live stream these shows. If you're listening on radio, make sure you follow us on Facebook and Instagram because we live stream a lot of our shows, like we'll live stream this one. And somebody said, winter's here, and it's hard to get out and work out. Well, that's okay. You can go out in the winter if you want to. But you can do things inside the house too, which is fine. And little things like when you brush your teeth, just do squats. Okay? Dry your shower. After your shower, I got a squeegee. I squeegee out my shower, and then I dry it out. And this way, the shower really doesn't ever need cleaning. You don't have to use chemicals to clean it because it's already wet and clean. You just got to prevent mold from growing. And when you're doing that, you're just keeping the body in motion. Take the stairs instead of the elevator. Park far away and walk. Like I said, I do radio shows and TV, so I always stand up when I do my shows. Some of my hosts that I work with will sit. I'm like, guys, stand up. You open up your diaphragm, you breathe better, and now you're also in motion as well. So anyway, some listen, some don't. Forgive them, for they know not what they do. But there's another exercise you can do called high-intensity interval training. Now, what this is, regular weight training and exercise is important. It's important for health and disease. But if you don't want to if your goal isn't to just be a professional bodybuilder, and even if you are, I want you to start considering high-intensity interval training because the way we do this is really cool. You want to get the body moving for 2 minutes, just whatever exercise you can do. Just do it slowly and kind of warm up a little bit. And now whether you bike, you row, you run, whatever exercise you're doing, aerobic activity, you do whatever that is for about 20 seconds, as hard as you can. So I don't care if you're mopping the floor. 2 or 3 minutes, gently, and then for 20 or 30 seconds, move really fast. Then you can take a 90-second break, and then you go back to the 20-second burst again. You'll do your entire workout. This is for muscle, it's for cardiovascular, it's for brain function, it's for lymphatic, it's for sacro-occipital function, the sacro-occipital pump. Your whole workout's going to be done in 20 minutes. Now, if you're really in a rush, you can just do 10-second rests between instead of 60 to 90-second rests. And again, this doesn't have to be exactly 60 seconds or exactly 90 seconds. You have to sit there and clock it. Go as fast as you can for 20 seconds. You'll be amazed how hard it is to do this. And whatever level you're at, as fast as you can is as fast as you can. There's no competition here. So if you can go, 1 mile an hour, and somebody who's in great shape can go 5 miles an hour, I'm making numbers up here, that's fine. It doesn't matter. Just doing more than you usually would just for these bursts of exercise, which is really great. Now, bodybuilders use this technique, and one of the things they do with weights, and you can do this with weights if you want to, you lift gently, okay, and then you go, 20, 30 seconds as fast as you can, and then go slow again. So whatever your exercise is, if it's cleaning the house, if it's brushing your teeth, if it's walking around, just do this, and you'll be fascinated how the body works so much more effectively. And you can do this on an elliptical machine, it's good, but I don't recommend you do it on a treadmill because you might not be able to switch speeds that quickly. Treadmill's got to slow down sometimes. So I've tried this on a treadmill. It's a little tricky sometimes. Now, my opinion, the best thing about high-intensity interval training is that you're done so quickly. I don't like working out. I like going for walks. In fact, this morning, my buddy Robert and I, we took a nice long walk. We were up in the North Georgia mountains. We found this cool cemetery with graves in it from the 1700s, and it was cool. It was just being out and being in motion. And he's tall, I'm tall, and so we walked pretty quickly. And so just something as simple as that is going to be great. Now, I've shared this technique with a lot of my friends. Some are weekend warriors, some are professional athletes, and they've all tried it, and they're always amazed with the results. Now, some of you people are professional exercisers. So for lack of a better term, I don't know what to use aside from that, and what they say, they're losing weight and feeling better with this type of workout, because sometimes people say, well, I hit a plateau. Whatever exercise I'm doing, I've peaked, and now I'm not getting any more results, so this is a nice way to shake it up. And I don't want you doing this too often. I only want you doing it 2 or 3 times a week. That's going to be the key. Now, one of the things, benefits with exercise is you produce something called human growth hormone, HGH. And so this is the key to working out, because HGH when you're young is it's everywhere because you're growing, human growth hormone. And as you get older, the HGH levels drop. And so that's why when you were young, you didn't have to work out as hard, you could eat worse, you didn't have to sleep as much, and you got great build. And now as you get older, it's a lot harder because the human growth hormone is dropping. So human growth hormone can be boosted by doing these interval trainings. In fact, it's the one exercise that actually boosts dramatically the human growth hormone. And it's produced by the pituitary gland, and it's a naturally occurring substance in the body. You're supposed to have it. Now, whenever you put something synthetic in your body, it's not going to be as good. So some of you may be thinking, well, if human growth hormone is great, I'll just take a human growth hormone injection or pill or whatever, and I'll get the benefits. Doesn't work that way. In fact, this morning I was talking to my friend Greg, and he was talking about he got a testosterone pellet I think they put it in the butt muscle actually, and he felt younger again. But the problem is when you put hormones into your body, there's what's called a negative feedback loop. So the pituitary gland is kind of like the big filter in the body. And so the pituitary gland says, okay, you got plenty of testosterone, you've got plenty of human growth hormone, you don't have to make any more. So the body says, all right, shut down production. If it's low, your body wants to increase it. So if you're putting it in artificially, it can affect your natural production. Now, sometimes you need hormone therapy. I'm not against hormone therapy. I'm just saying that if there's other ways you can get your hormones balanced, in this case, we're talking about human growth hormone, without taking it from an outside source, that's the better way to do it. A lot of people take Dr. Joe's Adrenal Support, and that's one of the supplements I recommend all the time, because Dr. Joe's Adrenal Support feeds the adrenals so they start producing adrenaline. And not only adrenaline, they produce prostaglandins, which control inflammation, and they produce something called DHEA, which then becomes your sex hormones. Now, we have a male hormone booster and a female hormone booster on the website, drjoe.com, and a lot of people take that as well. I take that every day because it's the raw materials that feed your organs to produce the hormones instead of just taking the hormone itself. Folks, got to go to break. If you have any healthcare questions, give us a call. The number's 844-44-DR-JOE. Hey, folks, Dr. Joe Esposito here, talking today about what happens when your body stays in motion and how you can make your exercise, whatever you're doing, whether it's brushing your teeth or if you like going to the gym for 4 hours a day, things that you can do to make it work better. Now, I got a bunch of callers here. Boy, the phone just lit up. If you have a question, lines are open, 844-44-DR-JOE. Make John work a little bit tonight. He's our screener. And when I come back, I'm going to answer some questions for us. I'm going to teach you an exercise, instant boost of energy. And Ahmad does this one all the time, so he knows this one. So, right? You know about this one, right, Ahmad? Yeah?
I think I have a clue.
You have a clue on this one, yeah. Ahmad stole this from me. But that's all right. Everybody steals our stuff. That's why we do it. I start taking some callers at 844-44-DR-JOE. Lindsay, how can we make your day better?
Hi, how are you?
I'm happy.
Me too. So my problem is that I am very freckly and moly. I always have been. And I was an idiot growing up, so I went to a lot of tanning beds. So
yes.
I regret it. But the last time I went to my dermatologist, he looked me over. He said he didn't want to poke me full of holes, but he did remove 3 freckles. I call them freckles.
Mm-hmm.
And all 3 were either moderately or severely precancerous. So I kind of want to go back and have him take more off.
Okay.
How concerned should I be? What should I advocate for myself? I kind of want him to poke me full of holes like Swiss cheese. If all 3 that he pulled off were moderately or severely precancerous, let's just go nuts and take them all off.
What I would do...
I don't know how medically sound that is.
Yeah, that may not be the most medically sound thing. That may be a little overkill. What I would do is get yourself on an anti-cancer diet. Because obviously you have a susceptibility to cancer. Obviously, okay? You have it already. The precancerous, I should say, okay? Not the cancer. But if you have the susceptibility, there's some easy things that you can do. And if you do all this, then you don't have to worry about going and get it checked so often. Now, you should because you have this history. But number one, you want to stay away from sugar. Sugar feeds cancer. And in fact, one of the ways they find cancer is they'll take a radioactive isotope and hook it to a sugar molecule, put it in your body, and then just track it. Go beep, 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 and it goes to the cancer cells. Because cancer loves to suck up sugar, and so it's an easy way to find out what a cancer is. So, you got to cut out the sugar. That's breads, cookies, cakes, donuts, pastas, of course, sugar, candies. You just got to stop the sugar. Is it hard? Yeah. Is it worth it? Yes. Now, if you go to our website, drjoe.com, we did a whole show on cancer. Just type cancer into the search bar and, hit your enter button, and it'll bring up the show on cancer. I'd recommend you listen to that one. Second thing
Okay.
is you have to, if you have a lot of freckles, you have to get your vitamin D levels. Everyone needs to get their vitamin D levels normal. Vitamin D is so important. There's studies showing that it works just as well or better than flu shots to help the flu. It helps brain function, it helps immune function, it helps heart function, and it helps with cancer function. So I would definitely make sure, if it's the winter, you got to take vitamin D. I say get your vitamin D checked, but you got to get vitamin D from the sunlight or from supplements. So you're not in the sun in the winter. So I take vitamin D supplements only time I don't take is in the summer, that one season. The other thing is Dr. Joe's Super Greens and Dr. Joe's Essential Source. They alkalize the system. Now, I'm not saying this is a treatment for cancer, but if the body's more alkaline, you're less likely to have cancer eruptions. Make sense?
Okay.
Okay, so listen to the
It
show.
does make sense.
Yeah, listen to the show. Vitamin D, Super Greens, and Essential Source, and then you should be fine.
Okay, well, cancer and I have that in common that we both like to suck up sugar, but I'll do
Yeah,
my best.
You are cancer. So cut out the sugar. Type in
That's
sugar.
my
Into,
mother. Okay.
type into the website on sugar, too. We did a show on sugar not long ago. Okay? All right.
Thank you very
Thanks,
much,
Lindsay.
Craig.
Appreciate the call. All right. What else we got? Tim, fellow truck driver. How can we make your day better?
Yes, sir. I was wondering if there was anything I could do while I try to get out every couple hours and walk around or whatever, but is there any, like, stretching or anything I could do while I'm going up and down the road?
Absolutely. Yeah. Consciously contract different muscles. Okay? And you can contract and relax it. So right now I'm contracting my thigh muscles. Okay? So what that's doing, it's contracting, it's pumping lymphatic fluid through my body. Contract your butt muscles. That's a biggie as a truck driver, of course. Contract your biceps. Contract your back muscles. Bring your shoulders back. Push your head against the back of the seat. Do 10 or 15 sets of that. Just gently pushing your head back against the back of the seat. So I used to drive a truck in New York City, and I understand what you're going through. The other thing that I do, like I had a 2-hour drive today, as a matter of fact, I drink a lot of water. I drink a lot of tea, actually, warm fluids, because it keeps my voice working. But then you got to get out and pee. And so I know you're driving. You want to keep going. Oh, just one more exit. You know how we are. Then you go up. I got to pee. I got to stop and pull over. So that's another trick you can do too. But just constantly contract each group of muscles, and just think about it: the front of your legs, the back of your legs, your butt muscles, your back muscles, your shoulders, your biceps, your triceps. Move your wrists around, push your head against the back of the seat, and that's a whole workout right there.
Okay. I mean, I also heard that our truck drivers susceptible to, like, the blood clots from sitting so long.
They can be. That's why I want you to contract the muscles, and also you got to be careful for a guy sitting around like that. Prostate issues. You're sitting a lot, and that's putting pressure on the prostate. So that's why it's really important to get up and move around, and make sure the bowels are moving. If you're constipated and you're sitting a lot, that puts a lot of pressure on the prostate, and that's not something you want. And if you have low back pain, that's the nerve supply into the prostate. So if you're having back and leg pain, which I had a lot when I was a truck driver, you want to get that fixed, come see us so we can fix it, because we want to open up the nerve supply to the legs and also the prostate as well. So,
Okay.
fair deal. All right, thanks, Tim. Appreciate the call.
Appreciate it.
Yeah, my pleasure. Yeah, folks, if you have a healthcare question, 844-44-Dr. Joe. James, I'm going to get to you after the break, actually, because it's a long question. How do you lose weight? And I'm going to answer that for you. But I'm coming up on a break here, so you're going to have to hang on for me, James. And if you have questions, folks, 844-44-Dr. Joe. Let's get John working in there, taking those calls for you. And so we're talking today about exercise and things that you can do to get the body moving, and why that movement is so important. Like we just talked about, my truck driver friend there, contracting the muscles pumps lymphatic fluid through the body. And if you missed what lymphatic fluid is, this show is going to be on the website tomorrow. The website, by the way, is drjoe.com, drjoe.com. And the minimum supplements, we talked about that with Lindsay, the minimum supplements you should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you're not taking those, you're really shortchanging yourself. Now, in the winter months, absolutely Dr. Joe's vitamin D as well. 5 drops. The cheapest insurance policy you'll ever buy is vitamin D. Most people are deficient in vitamin D. I'm shocked when people come in, I look at their blood work, and they say your vitamin D was low. Now, I want you to take vitamin D3, not vitamin D2. Vitamin D2 is the synthetic version, has to be converted into vitamin D3. So that's why ours is vitamin D3, and it also has vitamin K2 in there as well. And K2 is so important for bone function and bone growth. So the vitamin D with K2, it's on the website, drjoe.com. So is the Super Greens, the Essential Source. Folks, I got to go to a break. If you have any healthcare questions, lines are open, 844-44-Dr. Joe. When we come back, we're going to do Head to Toe with Dr. Joe. That's a little segment we do every show. And then we're going to talk about the little exercise you can do. You can do it anywhere, anytime, and it's amazing how much energy it gives you. And it also helps your brain work more efficiently. Who wants more brain function and more energy? Lines are open, 844-44-Dr. Joe. Hey, folks, Dr. Joe here. So glad you're there. I'm going to take a quick call. Got to cover head to toe with Dr. Joe and James, Diana, and I think it's Adavan, I think it is. Keep hanging on. After head to toe with Dr. Joe, I'm going to get right to you guys. And Justin, how can we make your day better?
Hey, Dr. Joe. How are you doing, sir?
Very happy.
I just want to say thank you for all your knowledge that you share. I listen to you a lot on the road, and it's really good to hear.
Thanks.
I just had a question about, I live here in North Georgia, and I just had a question and want to know your knowledge about eating deer meat.
Uh-huh.
Because I know you talk about eating plant-based, and if you do eat meat, eat organic, and
Right.
try not to eat too much, but I just wanted to know what your thought was on it.
In most cases, I'm okay. I mean, I wouldn't eat it, but I'm okay with you eating it because the deer are not eating the steroids and hormones and chemicals and the pesticides. They're not injected with any chemicals. Now, they could be eating crops that are sprayed with weed killers and things like that. We don't know that. But
Yeah.
I think you got a better chance of them being healthy than eating a commercial piece of meat, which we know has been exposed to these chemicals and steroids and hormones and everything else. So if you had to pick one, I'm going to say okay with the deer meat. How about that?
All right, man. I appreciate it.
Thanks. I appreciate that, too. All right. Before we go answer more questions, we've got to do this first.
Talking head to toe with Dr. Joe.
Yes, it is time for the Head to Toe with Dr. Joe segment. And if you're new to the show, once a show, we sit down with the Joe-it-alls, my crew here, and the Joe-it-alls, and we say, all right, what do you want me to cover today? And Lewis said, let's cover... Quick, get to the microphone, Lewis. Hurry. You said, let's cover...
You just put me on the spot. Now I'm blanking on it.
Pelvic girdle.
The pelvic girdle.
Yes, okay.
Oh, that sounds great. Pelvic girdle.
Yes, and Sierra said, where's the pelvic girdle? And I said...
Below the pelvic bra.
Exactly. That's what a pelvic girdle would be. So.
Just
Such
laugh
a
at
dad.
laugh at his dad jokes for his own.
Yeah, it makes me feel
His
better.
own well-being.
Yeah, just humor him, or else he'll get violent, right? So.
You're the boss. We have to make you think you're
Is it-
funny.
and then you leave and go, what a jerk. God, we got to be able to find another job somewhere. Is it Burger King hiring or something? So anyway, pelvic girdle. The pelvic girdle is a bunch of muscles that hold the pelvis together. Now, your pelvis, your hip bones there, and there's a lot of muscles involved in the pelvic girdle. And the reason it's important to know about, because any one of these muscles can malfunction. Your gluteus medius, your gluteus minimus, the piriformis muscle. This is a muscle that a lot of people never even heard of. It's a little tiny muscle, and it runs from your sacrum. Remember sacrum? We started earlier with the sacro-occipital pump. And the piriformis runs into your top of your leg, and when it contracts, you're able to turn your foot out. So if your foot is facing forward, you got to contract the piriformis muscle, and allows the foot to turn out. Now, why is that an important muscle? Why am I talking about this one little tiny muscle? The sciatic nerve runs underneath the piriformis muscle. And so many times you would think, well, if a muscle spasms, it can irritate a nerve. With the piriformis, if it gets weak, it can kind of flop down on top of the sciatic nerve, and that can cause problems. So one of the things I do with my sciatic patients, aside from adjusting the spine, because that's the key, is opening up the nerve supply through chiropractic care, is we teach them an exercise called the step out, toe out, where we take the foot and we have them turn the foot out, and they contract the piriformis muscle. Basically, they're on the heel, moving their foot in and out. And that can actually strengthen the piriformis. Sometimes I'll actually give them a little resistance to help build it up. So that can affect the piriformis, and you can be getting chiropractic care, and you can be getting injections and surgery, and you've had, how many of you have had this done, right? You've been through a lot of therapies and didn't get the results. I spent a fortune. I spent days of my life with the chiropractor or the physical therapist, or I had surgery, or I had injections. Nothing worked. The reason is no one ever looked at the piriformis muscle. Another muscle I like to talk about that's in the pelvic area is called the psoas, P-S-O-A-S. And the psoas muscle is this big, fat, thick muscle. And it runs from your spine, and it also goes into your top of your leg, and it's your major hip flexor. It's the reason you can bring your leg up and flex your leg. Now, the psoas muscle is interesting because it's the only muscle that attaches directly to a disc. All the other muscles attach from bone to bone. But this one actually attaches into the discs. So many times, if the psoas contracts, it can put pressure on the disc and actually pull the disc out of place. So we can go in there and do surgery or maybe injections into the disc, but if the psoas is spasmed, it didn't fix the problem. So this is why when we examine the pelvic girdle, we're going to have to maybe do a part 2 on the pelvic girdle. There's way more to talk about than we're going to have time for. But if the psoas contracts, it can actually pull a disc out of place. And what becomes the sciatic nerve wraps around the psoas. So if the psoas is contracted, it can be causing back pain and leg pain. So you may be going through this big extensive surgery and injections and everything else, and no one ever checked the psoas or the piriformis muscle. The psoas also attaches to your diaphragm. Now, if you listen to our shows in the past, we talk about the diaphragm a lot. It's a sheet of muscle. It kind of divides your body in half, and it allows you to breathe. And if the psoas is spasm, the diaphragm is being pulled on, and you may not be breathing properly. And if you have acid reflux, heartburn, burping, gas, bloating, the diaphragm has a hole in it called the lower esophageal sphincter. It's a very weak muscle. And it opens, allows food to drop into the stomach. It closes, then you digest food and you pass it on. If the stomach is pushing up through this weak muscle called lower esophageal sphincter or the cardiac sphincter, that can cause acid reflux and heartburn and burping and gas and bloating. And it's important that you get that fixed, not just treated with pills, but to fix it if you can, because the stomach breaks proteins into amino acids, and if a protein isn't being broken down properly, it passes into the small intestine where it can cause an inflammatory reaction. Autoimmune conditions can occur from undigested proteins. And the acid coming up into your throat can actually cause things like cancer in the throat, esophageal cancer. So, all right, so that's just a few muscles of the pelvic girdle. Folks, I'm Dr. Joe Esposito. When we come back, lots of callers. If you have any questions, give us a call. The number is 844-44-DR-JOE, 844-44-DRJOE. Hey, folks, Dr. Joe here. So glad you're with us today. Let me get some callers here. These poor people have been hanging on forever. If you have a question, number here at the studio, 844-44-DR-JOE. Diana, how can we make your day better?
Oh, hey, Dr. Joe. How are you?
I'm so happy you called.
Oh, well, thank you very much. I had a question for you about different chiropractic care. I had been heard about chiropractors who use an activator rather than the manual adjustment, and I didn't know. Are they both as effective? Go
ahead.
Well, is the activator as effective as a manual adjustment?
All our doctors are trained in activator. I am too. And the reason we have an activator is a little machine. It looks like a little tiny pogo stick, and you push it, and it's a little prod kind of pushes on the bones. And some people respond very well to activator. Some people respond better to manual treatments. And so all our doctors are trained in all the techniques so that whatever technique is going to work best for the patient, that's what we do. So I tell the patients on the first visit, we're going to use this technique on you. If you don't like it or you want to try something else, tell us and we'll use another technique. But we got to try it out on you to see which one's going to work. They're all very effective. It just depends on the patient and how they respond. Yeah.
Oh, that's really interesting. Okay, that's good to know. Okay, thank you for that. Yeah. I also had a quick question about arthritis.
Yes.
In the back, the facet joints or facet joints. I'm not sure how you pronounce that.
First way we correct.
Exercise, would you recommend, like you were talking earlier about, moving as much as you possibly can that's comfortable? And is there a diet that you should be looking to kind of help prevent more arthritis? I don't even know how to prevent arthritis.
Well, there's two types of arthritis. There's rheumatoid and there's osteo. Rheumatoid is an autoimmune disease. So with that, we want to calm down the immune system. When we get you on a good plant-based diet, we get you on super greens, essential source, vitamin D, build up the immune system. Now that winter's coming around, we also have something called Dr. Joe's Wellness Booster. Now, I take this every day. It stimulates white blood cell production. It's on the website, drjoe.com. It's a liquid. And then if I ever do start feeling sick, we have something called Dr. Joe Seasonal Tonic. Now, this stuff tastes awful. It's ginger, horseradish, cayenne pepper, onion, and garlic pureed in apple cider vinegar. Now, I'm Italian. I actually like it. I joke that it tastes awful. Some people are like,
It sounds good to me.
Yeah, if you like that, yeah. But it works amazingly well because the ingredients in there have been shown to be antiviral, antibacterial, and antifungal. Nothing really treats a virus in the medical world, but a lot of the natural herbs like garlic can. So that's what I do if I have somebody with an autoimmune disease. Now, the osteoarthritis is more mechanical. Bones are out of place rubbing up against each other. That's a simplified version. Actually, it's a white blood cell reaction. The white blood cells come in and break up the inflammation. And so osteoarthritis is always a mechanical component. And so if you have arthritis, that's a chiropractic case, 100% of the time. Because the bones are out of place, got to put them back in place. Yeah. Okay?
Okay.
There we go.
Yep. Okay. That's very helpful. Thanks for taking my call.
My pleasure. Look forward to seeing you soon. And if you do want to make an appointment, folks, you can go to our website, drjoe.com, or you can call us at the number you're calling here, 844-44-DR-JOE, and that number rings through to my offices. So Garrett, you have something to say?
Well, you mentioned the Wellness Booster and the Seasonal Tonic, and it's just about winter, and we're about to put up the winter bundle.
Oh, the winter bundle. Garrett does. See, Garrett, Garrett loves to spend my money, okay? So what Garrett does is he sneaks these specials on the supplements in, and then he doesn't tell me about it. And then I'll see it one day, and I'll go, Garrett. He goes, hey, come on, we got to get these people well. So he is your advocate, just so you know. Garrett is your biggest advocate.
And I love to do it on the air because then you can't take it back.
I can't take it back. I'm like, darn it. It's all over the world now. So, but Garrett puts together these seasonal bundles, especially in the winter with the Wellness Booster and the Seasonal Tonic. They're amazing. Vitamin D, so important for the immune system. But if you want to get well and you want to come see us, if you have neck pain, back pain, shoulder pain, numbness, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. Go to our website, drjoe.com, make an appointment. I'd rather you call, though, because then we can explain to you how to make the appointment. The number during business hours, 844-44-DR-JOE, D-R-J-O-E. We work with all insurance companies. We try to match your deductible as close as we can. Your copays, I'm sorry. There's in-network, out-of-network, but just call the office. They'll explain everything to you. But stop suffering. That's where I'm going. Stop suffering. Get well. The biggest complaint we get is, why didn't I do this sooner? And I don't want you to be one of those people. Is it Ativan? What? This is Dr. Joe. Who's this? Atuvian? Hello. Going once. Going twice. Yes.
Hello, Dr. Joe.
Yes, this is Dr. Joe. How can we help you? Yes, pay attention. Come on. Quick. What do you got?
I have a question on a male breast enlargement. And I've tried many things, and I'm trying to see if there's a way I can reduce it with some other ways. And
okay, this
if you can help me with that.
Yeah, this is actually not an uncommon situation. It's called gynecomastia, and it's when men start to develop breasts. And it happens most commonly when men are exposed to estrogen-like compounds. So where do we get this is a hormone called estrogen. Where do men get exposed to estrogen-like compounds? Many commercial animal products, dairy, meat, these animals are given estrogen-like compounds to try to get them to grow bigger. And they grow bigger, and so we can make more money. So first thing I recommend is staying away from animal products. If you're going to eat animal products, they need to be organic. Now, even the organic ones have some estrogen in it. So if you're worried about estrogen, and I am, I'd say no animal products at all. Also, if you're being exposed to chemicals like air fresheners, carpet cleaners, new car smell, plastic, if you have a plastic shower curtain, anything that's going to have that chemical smell to almost anything is going to be an estrogen-like compound. It's called an endocrine disruptor. And so if you go to our website, drjoe.com, and listen to a show that we did on male hormones, just type in male hormones in the search bar, and we talk about trying to balance out the men's hormones. I would also recommend, if this is happening, we have something called the Estrogen Blocker. It's on the website, drjoe.com. Men can take it because it prevents testosterone from converting into estrogen. We also have the male hormone enhancer. I would do that. That's DHEA. And then, of course, the minimum supplements, Super Greens, Essential Source, and vitamin D. So we have a whole protocol for you, and we can hopefully work on that for you, okay?
Okay, what about somebody drinking a lot of milk? Can I cut back on that?
Yeah, absolutely. No, milk is an animal product, and milk many times. I think what milk is for. Milk is given to babies to make them grow. And so estrogen is the hormone that makes babies grow. It can also make you grow. So I would absolutely positively stay away from dairy products, yes. And I think I did a show on that not long ago on how it affects men, just one glass of milk. I think it was last week, actually, protein. Last week. Go to our website, drjoe.com, and listen to the show from last week. You'll get a lot of information about animal products and hormones there. Okay?
Thank you very much.
Appreciate the call. Thanks so much. Folks, I'm Dr. Joe Esposito. Going to go to a break real soon. We only have 2 more segments. If you have any questions, give us a call. The number is 844-44-DR-JOE. The website, drjoe.com. Again, the minimum supplements you should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source, but we have about 15 or 20 other supplements. So go to the website. I can't imagine a day not taking supplements. In fact, one of my secretaries, who's worked for me about 8 years, asked me the other day how old I am. She thought I was 16 years younger than I am. This stuff really works, folks. This is a good lifestyle. Hey, folks, Dr. Joe Esposito here. If you can't hear the music, some of you around the country can't hear the music. There's Frankie Valli playing today. What happened to Frankie Valli? Our screener. Whatever happened to him?
Oh yeah, Ira. I don't know.
We liked him.
In a while.
He looked like he enjoyed being called Frankie Valli. So anyway, great play. One of the best plays I've ever seen. Jersey Boys. Unbelievable play. And I've been countless plays. I was the chiropractor for the Fox Theater here in Atlanta for a long time. I was backstage and I adjusted Jesus once. That was pretty cool. Jesus Christ Superstar.
I think that's a little biased, though. You are a Jersey boy.
I am a Jersey boy, yes. Well, he's mentioned the streets like the Turnpike or whatever in Bellevue, and I'm like, oh, I know these places. It's kind of cool. But a great play and really basic backdrop and everything. Not a lot of scenery. Really good play. That and Phantom of the Opera, my two favorites. Should anyone ever ask. Yes, that's right. Thank you. I've been promising to tell you this exercise that's going to give you energy, and people on social media yelling at me. So it's called the cross crawl. It's Ahmad's favorite exercise, as a matter of fact. Right, Ahmad? You like this one? He's doing it right now, as a matter of fact.
Yes.
I caught you in
His
front of...
only exercise.
No, he works. Look how good-looking he is. Man, we got a good-looking... If it wasn't for me, we'd have a really good-looking crew here, let me tell you. You want more energy, right? Everybody wants it. I'm going to tell you an exercise that's going to help energy. It's going to help your brain function. It's going to help balance. It's amazing. It's called a cross crawl. And what you do is, well, let me explain it. The right side of the brain controls the left side of the body. Left side of the brain controls the right side of the body. It's crossed. And that's why if you have a stroke on the right side of your body, the damage is on the left side of the brain. Most of us segregate our brains every day. We use one side of the brain. We'll brush our teeth. We'll work our mouse. We'll start our car. We'll talk on the phone. We're using one side of the brain, and that's segregating the brain. We need to integrate the brain. We need to use both the left and right side of the brain. So even when we walk, we don't do this because we may have a phone in our hand. We may have a purse on. But what I want you to do is I want you, if you can right now, stand up. Okay, if you're in a car, of course, don't do that because it's not good. And I want you to march in place. But I want you to raise your left leg and your right arm. And then your left arm and your right leg. So right arm, left leg, left arm, right leg. And you're going to march. And if you really get good at it, like Ahmad, who's the master of the cross crawl, he takes his right elbow and brings it to his left knee, and then he takes his left elbow and brings it to his right knee. Now, you're going to try this, and about 10% of you are not going to understand what I'm saying. And the reason is your brain is not integrating. So you have to physically work. Left elbow to right knee. Bring up the right knee, bring the left elbow down. Left elbow, right knee. And you got to reboot your brain. And if you can do this cross crawl 30 seconds, you will be fascinated at the results. In fact, a neat little trick I want you to do tomorrow morning, put a note up so you don't forget. I have sticky notes. I love sticky notes. They're all over my life. And when you get out of bed, just stand up and just walking to the bathroom. Right arm, left leg, left arm, right leg. Right arm, left leg, left arm, right leg. Walk to the kitchen. Right arm, left leg, left arm, right leg. Exaggerate it. Now, if you're at work and you're drinking a lot of water like you're supposed to, you got to get up to pee, you can be a little less obvious because people think you're crazy, but you don't care if they think you're crazy. Knock yourself out. And just swing your right arm and left leg, left arm and right leg. Ladies, if you have a purse, just put it over your shoulder. I don't like you talking on the phone. If you're going to talk on the phone, I want you using an earpiece anyway, so if you have an earpiece, you can swing right arm, left leg, left arm, right leg. I've done this. I remember giving a lecture many years ago to a high school basketball team or athletic group, and I had the number one shooters on the team. I said, shoot a foul shot. Boom, no problem. So I messed them up. I had to march, but I had to march right arm, right leg, left arm, left leg. Right arm, right leg. I did it backwards. I said, now try to shoot a foul shot. They weren't even close to the rim. They're like, what'd you do to me? They got scared. And then I fixed them. I said, right arm, left leg, left arm, right leg. I do this before a radio show. I do this before I do TV shows. I do this before I have a big event, a meeting. If I'm tired, if I'm walking through an airport, I'm just exhausted. If I just want to give myself a boost of energy and get my brain working more efficiently. That's why it's so important for babies to crawl. Because when a baby crawls, they're doing a cross crawl. Right arm, left leg, left arm, right leg. If you see a baby that can't crawl, here's what I want you to do. Lay them on their back. Get two people. One person grab the right arm and the left leg. The other person grab the left arm and the right leg. And mimic that crawling motion for them. And that can actually help reboot the brain. It's powerful, powerful technique, this cross crawl. If I had to give you one exercise to do, I want you to do this one. It's incredible, the results. And like I said, do it just walking around. And a lot of people have given up their coffee from it. If you have to go into a job interview after lunch and everybody's exhausted, you do the cross crawl, you're going to win. It's pretty cool. So that's called the cross crawl, and I got to go back to these callers here because everybody's blinking at me here. Number here at the studio, 844-44 Joe. Lisa, how can we make your day better?
Hey, Dr. Joe, how are you doing today?
I'm well.
I was wondering how you could get rid of calluses off your feet.
What usually happens with calluses is the bones in the feet move out of place, and that puts stress on the skin, and that's why you develop calluses. So it could be your shoes. I know I was wearing shoes for a long time. I didn't like them, but they always hurt my feet. Then I went to Merrell's, and I loved my Merrell's, but Merrell's were heavy. Now I went to Skechers, and I'm a huge Skechers fan. I just love Skechers now, and that's my favorite shoe.
That's all I wear, Skechers.
Perfect. But usually when you develop calluses, the bones in the feet are out of place. 1/4 of all the bones in the body are in your feet. So any one of those bones can come out of place, and when that starts to happen, that can cause calluses to form. So calluses are a warning sign telling you something's out of place in your feet. So come see us. We'll adjust your feet.
Okay, thank you. Have a
Thanks
good
so
day.
much. And again, just like pain is a warning sign, calluses can be a warning sign. They're telling you something's out of place. And if they get bad enough, then the bone warps and you may need surgery. So as soon as you start to develop, I'd recommend come see us and we can adjust the feet. And then I'd also check the nerves in the low back because those are the nerves that control the feet. JJ, how can we make your day better?
Dr. Joe, this is sort of an unusual question, but I have always wondered about those cooking sprays that we buy in the grocery store that's supposed to help make foods not stick to the pan. Should we avoid those?
Absolutely. All of them have either propellant or they're omega-6 fatty acids like canola oils or peanut oils. You can get a spray pump. If you go to a really high-end kitchen store, there's a pump, and it's a manual pump, and you got to pump it up, and then you can spray. And I would use like an olive oil, extra virgin organic olive oil. Avocado oil is very good if you're going to be cooking. But I would never use the ones with the propellants in it. And the other one is recyclable. You have to just pump it up. You use it over and over again. So it's going to save you money in the long run, and you get to choose the oil, which is going to be a good oil. So it's an excellent question, and you're absolutely right.
Thank you so much.
Thanks,
Enjoy
JJ.
your show.
Thanks so much. Yeah, I got one of those pumps. It's really cool. You just got to pump it. And you know what? That's called exercise. And that's what we're talking about today. And you can contract your muscles, which will help the lymphatic system. It can help the heart rate go up. It can build muscle mass. I mean, of course, pumping that up isn't going to build a whole lot of muscle. But these are just the things you can do in life to keep the body in motion, because that's what we're talking about today. You don't necessarily have to hit the gym and work out, 2-3 hours a day. As long as the body's in motion, you're going to get the health benefits. If you want to build muscle mass, again, the more, the better, but just staying in motion is going to help. We only have one more segment left. I can't believe this. If you have any healthcare questions, give us a call. The number is 844-44-DR-JOE, 844-44-DRJOE. That number rings through our offices when I'm not on the air, so you can make appointments, come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We're going to open up in West Cobb pretty soon and probably in Decatur. And again, if you're listening around the country or around the world, you have no idea what that is. But if you've gotten good results, if you're liking the show, feel free to give us a good review. You can do that on, what is it? Where do we give reviews?
Facebook, Google, all those
Yelp.
good things.
Yelp
is a good one.
Yelp's a good one, too. Yeah, we want to help people know that this is out there and that we're getting great results, and you're getting great results. So if you like that, feel free to give us a review. Got to go to break, folks. If you, again, want to make an appointment, 844-44-Dr. Joe during business hours, or you can do it online at drjoe.com. There's Joe Jackson stepping out. I know some of you can't hear the music, but I love that song. I don't know what it is, something about that piano riff. Is it a riff in a piano? I don't know, guitar riffs. I don't know, is it a piano riff?
Yeah, always.
It's a piano riff? Okay, I just love that riff that he plays. And my friend Scott plays piano, and he says it's really hard. It sounds pretty easy, that little thing, but it's actually a complicated thing. But anyway, Stepping Out by Joe Jackson, one of my favorite songs. I'm a big music guy. Wish I'd learned music. Let's take another call here at 844-44-Dr. Joe. Tracy, how can we make your day better?
Hi, Dr. Joe.
Hi.
Love your show. Information is so invaluable.
You're a smart woman, Tracy. Yes, all women should be smart like you. Yes, there you go. All people should be smart like
I
you.
try my best.
Good
I'll
job.
try to make this as quick as possible so other callers can get through.
Yes.
I was calling in reference to something you mentioned about 30 minutes or so about hormone replacement therapy.
Yes.
And you spoke specifically about the gentleman taking the pellets for testosterone.
Yes.
But that if you're living right and you take the proper supplements if needed, that will help your body produce the hormones that it needs to produce or
Correct.
balance them out on their own.
Yes.
So my question is for a woman who has completed or is in menopause, is there anything to naturally induce estrogen without taking any type of hormone replacement therapy?
Yeah, the ovaries make estrogen, but the ovaries make your sex hormones, but so do your adrenal glands. So as we get older, I strongly advise you get on adrenal support, Dr. Joe's adrenal support, because, again, we can fight Father Time. And like I said, my secretary's worked for me like 8-10 years. She thought I was 16 years younger than I am. And I was like, I like you. She got a raise. She got Employee of the Day. But Dr. Joe's adrenal support is so important to keep those adrenals because it's raw materials that feeding our organs as they get weaker. Now, we also have women's hormone regulator, and that's DHEA. And DHEA is the precursor to estrogen. So I would say adrenal support and women's hormone support, they're on the website, drjoe.com. And the minimum supplements everybody should be taking every day is Dr. Joe's Super Greens and Dr. Joe's Essential Source. So if you took those, and then if you're starting it in circulatory issues, you might want to consider Dr. Joe's nitric oxide as well. But the female hormone support, the adrenal support, Super Greens, and Essential Source are the minimums. And you got to get your vitamin D, Tracy. So I'd recommend vitamin D as well.
Okay, that's D3 you were mentioning?
Yeah, absolutely. Yep, not D2. Yep.
Okay, and that will balance out all the hormones that you need, the progesterone, testosterone.
That's going to help. And then to go to our website, drjoe.com, and listen to the show I did on women's hormones. Just type in women's hormones or female hormones, and you can listen to 2 hours of me yapping just about that topic. How about that?
And we have a part 1 and a part 2.
Oh, that's right, Tracy. Garrett just reminded us that, with women's hormones is part 1 and part 2. So much to cover. We did it in 2 shows. So you can get it all there on the website. Okay?
All right. Excellent. Thank you so much.
Thanks, Tracy. Nice talking to you. Caller called in, lives in Cumming, Georgia, wants to know when we're going to open office there anytime soon. We have an office in Duluth, which is the closest one to Cumming, and all of our Cumming patients actually go to our Duluth office. So if you want to call the office during business hours, 844-44-Dr. we can get you set up to go to our Duluth office, which is fine. We're trying to open more offices. The big problem I'm having is finding doctors that I trust. We can open offices anywhere we want. I got to get staff members to work them, and that's where I'm finding a challenge. So that's where we are. If you want to get into the world of healthcare, let us know. Maybe we can hire you on. So, in honor of Ahmad playing Steppin' Out by Joe Jackson, one of my favorite songs in the world, let's talk about stepping out. Another exercise you can do is 10,000 steps. And this is a really simple thing because you have to do nothing except stay in motion. We talked about motion with the lymphatic system and the cerebrospinal fluid pump. If you missed all that, this show is going to be on the website tomorrow, drjoe.com. But you got to walk 10,000 steps a day. If you're doing that, that's the equivalent of a 20-minute aerobic workout. Now, some studies are showing 6,000 to 7,000 is enough. I'm going to shoot for 10, though. Let's shoot high. You know, always shoot for the stars. Get a pedometer, put it on your belt. I don't want using your phone as a pedometer because the phone releases electromagnetic frequencies. And if you go to our website, drjoe.com, and type, I guess electromagnetic frequencies should come up. Yeah, if you type in electromagnetic frequencies, you're going to listen to a whole show we did on dangers of cell phones. So get a pedometer. They cost about $5 in the big box stores. Put it on your belt, and I want you walking 10,000 steps a day. My coworker, Eric von Hessler, he was overweight. He was not the healthiest guy in the world. He was younger than me, and he said something about, wait till you get to my age. And I said, Eric, I'm 5 years older than you. And he said, you are not. And I told him how old I was, and I had to prove it to him. And hopefully that was the motivating factor. But he's walking now and looking
Pulling
great.
out your wallet.
That's right.
Just like the what is that called? The shock.
Yes, that's right. This is how old I really am. I promise you. And it's great. So I'm fighting Father Time, man. I ain't giving in. I ain't going down without a fight. But he started walking he's walking 10,000 steps a day now. He's lost weight. He feels great. He's having energy. His brain is clear. His shows are, he even said, my shows are better. And I said, they are, Eric. You're always amazing. You're even more amazing, if that's possible. So it really does work, just keeping the body in motion. So you want to walk 10,000 steps a day. Most people walk about 5 or 6. So what you can do is real simple, is put the pedometer on for about 2 or 3 days. Don't change your lifestyle. Just do whatever you're going to do. And then you're going to see, okay, I do 5,000, 6,000, 7,000 a day. What do I got to do to get another 3, 4, 5,000 steps? So walk the stairs. And he knows, we know how long our breaks are when we're on the air. So he knows how far he can go and get back to the studio in time. He'll go up the stairs, down the stairs. He'll go to security, which is on the second floor in a 3-story building. And he'll tell security, listen, I'm not crazy. I'm just walking around here. But he's doing great. And you can do that too. Take the stairs instead of the elevator. Park far away and walk. Like I said, drink a lot of water. Get up and pee. Go to the bathroom that's far away. Cross crawl when you're walking. Right arm, left leg, left arm, right leg. And so these are simple things that you can do to get the body in motion. And you got to make sure you're eating the right amount of food, the good foods, to make the body work. So the best foods we can eat are going to be fruits, vegetables, nuts, and seeds. The 7 deadly sins I want you to consider cutting back in your diet or cutting out are alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I know most of you are saying, but Dr. Joe, that's my whole diet. No, it's not. Well, it might be, but it doesn't have to be. So minimum supplements you should be taking every day, Dr. Joe's Super Greens and Dr. Joe's Essential Source. Omega-3 fatty acids. Most people are deficient in omega-3 fatty acids, vitamin D, and magnesium. Those are the 3 supplements most people are missing. Super Greens and Essential Source is going to give you a ton of nutrients, including magnesium. The omega-3s, I take Dr. Joe's vegan omega-3s. They're on the website, drjoe.com. And people ask me all the time, how does your brain work the way it works? What's going on in there? How does your brain answer these questions rapid fire and you don't have to think about it? I take good care of my brain. And one of the things I do is the vitamin D. I also take nitric oxide to increase circulation. But the vitamin D is a nutrient that most of us are deficient in. The omega-3 fatty acids, most of us are going to be deficient in those as well. And then, of course, the minimum supplements would be Super Greens and Essential Source. So I couldn't imagine a day not taking my supplements. I travel with them. The Super Greens and the Essential Source travel real well. None of them get stopped at security anywhere, so you're going to be fine. Folks, if you can believe it, that was 2 hours of amazing information. If you missed a show, it's on the website, drjoe.com, along with over 1,000 hours of podcast, audio, and video. If you have questions I didn't get to, send them to me through the website, drjoe.com, drjoe.com. All the supplements are on the website if you want to make an appointment to come see us. Stop suffering needlessly. Come see us. You're going to be happy you did. The website, drjoe.com or 844-44-DR-JOE. Thanks for tuning in. Tell your friends about the show. We'll catch you next time.